Welcome. My name is OKUNEV. I'm a biostatistician at the DENTAQUEST partnership, and my presentation is called The Downward Trends in Dental-Related Opioid Prescriptions Among the Medicaid Population. For this study, we used the IBM Watson Medicaid claims database with medical, dental, and pharmaceutical claims from 13 de-identified states. Time frame is 2012 through 2017, and in this study, we have 8.8 million dental patients. Opioid prescriptions were linked with dental claims by date of service. So if an opioid prescription occurred within 3 days of a dental service, it was considered a dental-related opioid prescription. However, if a medical service occurred within 3 days of that opioid prescription, it was excluded from dental-related opioid prescriptions. Patients were categorized into two age groups, 0 to 20 for children, 21 to 64 for adults, based on child Medicaid eligibility. Dosage strength was measured by morphine milligram equivalent units, or MME per day. In this case, 1 milligram of morphine equals 1 unit of MME, and this is a way of normalizing opioid prescriptions. In general, we saw opioid rates decline between 2012 and 2017. Opioid prescriptions per 100 patients declined by 39% for adults and by 27% for children. In 2012, 28.3% of adults received an opioid prescription. That dropped by 27% to 20.7% of adults in 2017. For children, percent of patients to receive an opioid prescription dropped from 2.6% to 2.2% in 2017. That's a drop of 18%. Opioid prescription rates for surgical encounters fell by only 3% for children and by 18% for adults. However, for non-surgical encounters, opioid prescription rates fell by 48% for children and by 42% for adults. This is a good thing because non-surgical encounters should not be associated with opioid prescriptions at all, as a general rule. Opioid prescriptions, as defined by dosage strength, showed dosage strengths decline over time. In the lowest grouping, under 20 MME per day, we saw 14% of total in 2012, and opioid prescriptions went up to 15.8% of total in 2017. For the two highest groupings, 50 MME per day and up, we saw prescriptions as a percent of total go from 15.8% to 12.9% in 2017. So dosage strengths have slowly gone down in the time period studied, and this is a good thing because the lower the dosage strength, the less potential for addiction. So now we're up to the practical implications. So opioid rate declines that we saw are a good thing. However, the overall rate we think is still too high. Opioids are being prescribed for non-surgical encounters where they shouldn't be prescribed at all. And opioids are being prescribed where alternatives might be more effective at treating dental pain with less potential for addiction. For example, there was a study by Paul Moore and Elliot Hirsch that showed that combining ibuprofen and acetaminophen is the most effective treatment for treating dental pain from third molar extraction, even better than opioids. Dentists should check the appropriate core guidelines. Core is the Center for Opioid Research and Education, and they have guidelines for prescribing opioids for dental procedures. A CTC app can help prescribers figure out what the dosage strength of their prescription that they're prescribing. It'll give them the MME per day and will show them some clinically recommended guidelines. Finally, dentists should check with their state's PDMP if they have one to see their patient's opioid prescription history. That concludes my presentation. Thank you and have a great day.